Assalamualaikum warahmatullahi wabarakatuh. Today will be presenting TBL1 for Biomechanics and Kinesiology. So this is our group members, and this is our table of contents. So we have number one, introduction; number two, differential diagnosis; number three, provisional diagnosis; number four, treatments; and then lastly we have number five, conclusions. So for introduction, this is the topic given to us: orthokinematics of the tibiofemoral joint, screw home mechanism, and then we have knee complex. Knee complex is composed of two distinct articulations located within a single joint capsule, which is tibiofemoral joint and patellofemoral joint.
Assalamualaikum warahmatullahi wabarakatuh. My name is Solihin and I will explain about knee osteoarthritis. Osteoarthritis is a form of arthritis which is pain and inflammation of the joint. It is also called wear and tear arthritis caused by many years of usage. It can lead to pain and loss of function. In the knees, it affects the tibiofemoral joint and patellofemoral joints. So some of the signs and symptoms of knee osteoarthritis are pain on movement, stiffness, loss of range of motion, pain after prolonged lying or sitting, pain on joint line palpation, and it may also be accompanied by crepitus. And lastly, for mechanism, the wearing away of the knee joint can cause the decrease in its range of motion. Thus, if the knee cannot be fully extended, the screw home mechanism can be disrupted. It may not be able to extend to the last 0 to 20 degrees that locks the knee by tightening the ligaments around it.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Afiq bin Muhtar and my metric number is 2010649. So for the second differential diagnosis, we have meniscus tear. What is meniscus? Meniscus is two C-shaped piece of cartilage. It is a cartilage and act like a cushion between your shin bone and your. It is tough, smooth, and rubbery, and their cushioning of the joint keeps its stability. Meniscus also often thought of as being shock absorbers between the thigh bone and the shin bone. From the picture here, we can see that the knee joint is made up of femur, patella, and tibia. So from the medial side, we have medial meniscus, and at the lateral side, we have lateral meniscus. So how can meniscus tear happen? The meniscus can be torn in two main ways. The first one is traumatic tear and the second one is degenerative tear. The traumatic tear can happen when twisting injuries to the knee. This can happen during sports or even while doing things around the house or office. Road accident also another common way of injuring the meniscus. For a degenerative tear, as you age, your meniscus also going old. They wear out and can tear with minimal trauma. Often people don't remember what caused the tear at all. So for the signs and symptoms, if you have torn your meniscus, you might have the following signs and symptoms at your knee. The first one is popping sensation, next swelling or stiffness. The third one, pain, especially when twisting or rotating your knee. And the fourth one, difficulty strengthening your knee fully. Fifth one, feeling as though your knee is locked in place when you try to move it. And the last one, feeling of your knee giving away. For the mechanism, the meniscus are known to be vital for the normal function and long-term health of the knee joint. The meniscus increase stability for tibiofemoral articulation. Distribute as a load, absorb shock, and provide lubrication and nutrition to the knee joint. We believe that meniscus helps a lot during screw home mechanism in stability of tibiofemoral articulation throughout the locking and unlocking process of the knee. That's all from me. Thank you very much.
Hi, my name is Ramazawani Alia, metric number 2015226. Now I will talk about articular cartilage injury. First of all, articular cartilage is a firm rubbery layer of smooth white connective tissue that covers the end of bones. It includes medial condyle and lateral condyle that is located between the distal of femur and proximal of tibia. It provides a slick gliding surface for joints and acts as a cushion to keep the bones from rubbing. Cartilage can break down due to overuse or injury, which can lead to pain, swelling, and stability problems with the joint. Articular cartilage injury, known as chondral injury or osteochondral injury, occurs if there is damage to the underlying bone. However, articular cartilage injury usually happens if twisting to the knee and damage to soft tissues. The situation can worsen by the amount of weight or loading put on the joint, such as in the case of obesity. In some cases, an articular cartilage injury can heal with rest. However, most often the damage progresses over time and can eventually develop into osteoarthritis of the knee. Next, sign and symptoms. Those patients who are facing articular cartilage injury might have pain in the joint, stiffness. Also, they have limited functionality of the knee, and their knees might be swelling. And also might have loose body in the knee that shows the full thickness articular injury. Besides, lack of stability of the knee due to screw home, movement is disrupted. Okay, next, mechanism. Knee condyle injuries are usually caused by twisting or bending force applied to the knee, and from the tear of the condyle can result in the loose body in the knee, which means there are pieces of condyle in the tibiofemoral joint as shown in the slide. Consequently, the locking of the knee or screw home mechanism can be disrupted when the fragments of cartilage hinders the smooth movement of the joint. The knee may become swollen, and weight-bearing activities can be painful because the knee is not in its stability. So that's all for me. I will pass to the next presenter.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Afiq Fikri bin Rusli and my metric number is 2017801. So today I will be talking about the ligamentous sprain or anterior cruciate ligaments injury. Okay, so firstly I will be talking about its anatomy. Okay, so the anterior cruciate ligament ACL runs from the femur to the tibia and is made up of dense connective tissues. And the anteromedial and the posterolateral bundle are the two sections of the ACL. Okay, so in the center of the knee, the anterior cruciate ligaments extend diagonally. Okay, so it gives kind of a rotational support to the knee and prevents the tibia from falling out in the front of the femur. Okay, so the posterior articular branches of the tibial nerve innervate the ACL, which is vascularized by branches of the medial genicular artery. Next, I will be talking about the overview of ACL. What is ACL injury? Okay, so an ACL injury is the overstretching or tearing of the anterior cruciate ligament in the knee. Okay, so a tear may be partial or full. As you can see in the picture, it may be partial or a complete tear. Next, I will be talking about the signs and symptoms of an ACL injury. Okay, so the first one is a loud pop or a popping sensation in the knee. Okay, so the noise and pain may be a mechanical problem, which feels like something is caught in the knee as it moves back and forth. Okay, so next we have severe pain and inability to continue activity. So if, for example, you are doing an activity and your ACL is injured, so you will have difficulties in continuing doing that particular activity. Okay, so next we have rapid swelling. Okay, so your knee will swell within 24 hours, and if the swelling and pain are ignored, they can go away on their own. But if you try to return to sports or return to doing what activities you are doing, your knee will most likely be unstable and you risk more damage to your knee's cruciate ligament or cushioning cartilage. Okay, so next we have loss of range of motion. This one is self-explanatory because when your ACL is injured, you will have like a difficulty in moving that particular area, which is the knee. And lastly, we have tenderness along joints line. Okay, so whenever you touch or move your knee in the slightest way, you will feel pain or discomfort in the affected area. So next, I will be talking about what happened to the screw home mechanism if the ACL is injured. Okay, so the rotation between the tibia and femur is known as the screw-home mechanism, and it is thought to be a crucial component of knee stability for standing upright. So between complete extension, 0 degree, and 20 degrees of knee flexion, this process acts as a vital feature of the knee. Okay, so the tibia, at this point, the tibia is in a state of maximal stability with respect to the femur as the knee reaches terminal extensions, and the leg is able to support body weight despite the quads not being engaged. Okay, so the anterior cruciate ligament (ACL) plays a critical role in this operation, and any ACL issues can stop or slow the screw-home mechanism. Okay, so the screw-home mechanism of the knee joint is a crucial mechanism that controls the knee terminal extension. It is like a form of automatic axial rotation that is inextricably and involuntarily linked to flexion and extension movements. Okay, so at this point, the tibia rotates internally while the knee is flexed, and the femoral condyles roll and glide off the tibial condyles as the knee is extended, and the tibia is steadily and externally rotated, and the knee joint locks at full extension and providing maximum support in the upright standing position. For the alignment of the knee joint with the adjacent hip and ankle joints, the screw-home mechanism is critical. While flexion extension is the primary movement of the knee, internal external rotation is very important, particularly in all of pivoting activities.
I am Riza. I will explain about the provisional diagnosis. The screw-home mechanism of the knee joint is a critical mechanism that plays an important role in the terminal extension of the knee between full extension 0 degree and 20 degree of knee flexion. If the knee cannot fully extend, the screw-home mechanism cannot happen. The anterior cruciate ligaments or ACL plays an important role in the mechanism, and any ACL problems may restrict or stop the screw-home mechanism. The screw-home mechanism occurs when the lateral pull of the quadricep. The quadricep insert into the tibial tuberosity via the patellar tendon. When the quadricep contract, the quadricep can cause the anterior translation or gliding of the tibia on the femur. This creates a passive tension in the anterior cruciate ligaments or ACL, which contribute to external rotation of the tibia. This passive tension helps to stabilize the extended knee by resisting the excessive anterior translation of the tibia or excessive posterior translation of the femur. Next, in order to unlock the knee from the extension, the popliteus muscle must work to initiate the internal or external rotation. The tibia must internally rotate or medially to allow for the knee flexion open change, and the femur must externally rotated for the knee flexion in the closed chain. This mechanism of rotation contribute a proper movement of the knee. ACL injury may be injured if the knee joint is bent backward, twisted, or bent side to side. The chance of injury is higher if more than one of these movements occur at the same time. Contact or being hit with another person or object also can cause an ACL injury, and ACL injury often occur during sport. The injury happens when the foot is firmly planted on the ground and a sudden force hits the knee while the leg is straight or slightly bent. This can happen when changing direction rapidly, slowing down when running, or landing from a jump. This type of injury common in soccer, skiing, football, and other sports with lots of stop and go movement. Falling off a ladder or missing a step on the staircase are most likely other causes. Like other parts of body, ACL also become weaker with age. So tear can happen more likely and easily in older people which age more than 40 years old. The screw hole mechanism occur in anterior cruciate ligaments injury already previously explained by Brother Afiq. The untreated ACL injury can be developed into chronic ACL deficiency, which are an unstable knee joint. ACL deficiency can cause damage to the joint and osteoarthritis. This can lead to other complications such as lock joint. That's all from me. Thank you. I will pass to the next presenter.
So for treatment, firstly we have first aid. So in first aid, first you need to rest. Resting is necessary for healing and it limits weight bearing on the knee. Second, you need ice. You should ice the knee at least every 2 hours for 20 minutes at a time. Then you compress the knee by wrapping the knee to keep it from moving, and then you elevate the knee. When you lie down, you put your knee prop up on pillows, and then we have rehabilitation is treatment, the early treatment by therapists. So a therapist will plan the exercise for the patient, and the goal of rehabilitation is to reduce pain and swelling, restore knees full range motion, and strengthen muscle. And lastly, we have surgery. So for surgery, doctor may recommend surgery if the patient is an athlete and want to continue in his sport. Uh, if the patient has more than one ligament or the fibrous cartilage in the knee is injured, and the injury is causing your knee to buckle during everyday activities.
Bismillahirrahmanirrahim. I will explain for the conclusion and Islamization. For the conclusion, screw hole mechanism is a mechanism that helps in knee stability for standing upright by locking and unlocking the knee. Several pathologies has been diagnosed as differential diagnosis for the mechanism. Those are knee osteoarthritis, meniscus tear, articular cartilage injury, and anterior cruciate ligament injury or ACL injury. For the Islamization, Allah Subhanahu wa Ta'ala mentioned in Surah Al-Baqarah, verse 195, which means, spend in the cause of Allah and do not let your own hand throw you into distraction by withholding, and do good, for Allah certainly loves the good doer. As a Muslim, we should try our best to avoiding anything that will cause harm to ourselves. We should practice sport in a safe way with safety equipment and abide the rule. These are the references that we use for the slide. That's all from us. Thank you.